Hello people, welcome back to a new video. This video is going to be all about the Australian healthcare system,
Yes.
OSHC. What will happen if something
Goes wrong.
goes wrong?
God forbid. Touch
Or
wood.
it doesn't happen. Maybe if you break a bone, maybe if you have a disease, maybe if you get COVID or any health related diseases or mishaps.
Yes.
What will happen, how to deal with it, and we'll tell you our personal experience as well.
Yeah, definitely.
So I
Let's
hope this
get-
video helps.
Yeah, let's get into it. So, if you're an international student and you're coming to Australia to study, you would need what you call an OSHC, which is basically health insurance.
Health insurance.
And there are lots of providers for it. You can choose whichever you want. For example, I'm in NIB and
I'm in AHM.
yeah, you're in HM, and we have had very different experiences in
Yeah.
both of them.
OSHC is Overseas Student Healthcare.
Yes.
It works like any other medical insurance because anything medical in Australia is pretty expensive.
Yeah.
So from personal experience, X-rays, even a simple X-ray can cost you around 150 to 200 bucks.
Yeah.
So that's just a simple example. I personally wasn't given a choice when it came to OSHC.
Yeah.
So my agent just told me that, hey, you have to get an OSHC. It will cost you around $1,100 to $1,300, around that, and you have to pay for it. I'm like, cool, okay, because I thought that there are not a lot of other providers available for me,
Yes.
which is not that big of a problem, but it would be good to have
To
options.
know, right?
Yeah.
So that was the case with me. My agent told me there are a bunch of providers that you can go through, and all of them have their pros and cons, and some of them cover different things, and some can cover different things, and then you can even have add-ons like dental, which are not usually covered, and the chiropractors.
Physiotherapy sessions sometimes.
Physiotherapy sessions are not usually included.
Personal experience.
Yeah.
For anybody who wears spectacles, get your eye test done before you're coming to Australia, because like institutions like Specsavers or Perry Nelson, these are some institutions which are pretty popular here in terms of eye care and spectacles. And if your eye test is dated more than a year back, they won't accept it.
Yeah.
They won't accept it. They'll tell you to get an eye test done with them, which will cost you around $50 to $75, and that is just a waste of money, because from India, where I'm from, it costed me 0 rupees, because Lenskart used to do it for free for us.
Yeah.
So just get it done and get it here, so that you don't have to spend on eye tests. And I would say get 2 to 3 pairs of spectacles with you, because a new pair of spectacles will cost you anywhere around $200 to $300.
Yeah.
With the
Spectacles are
glasses.
definitely expensive here.
Yeah. If you break your only pair of spectacles, which you shouldn't have, only one, you should have 3 or 4. But if you only have one, it will cost you anywhere around $400 to $500. Services like these, some are not covered in your OSHC.
Yeah.
You can obviously get an add-on.
Yes.
If you're someone who is prone to having dental
Dental
problems,
issues, yes.
or is prone to having maybe hearing problems or back problems, just get physiotherapy sessions included in your OSHC.
Yeah.
It
It's
does-
like $400 more for 3 years, which is a typical bachelor's degree would cost $400 more. Like, I did not take dental, and I wish I did now, because I want to go through some dental work, but I can't do that because it's too expensive here.
It will look more in the start.
Yeah.
Like $400 might seem more when you're paying your visa fee, when you're paying your plane ticket, when you're paying your when you're paying your academic fee. But from experience, it's better to get it
Just
included
pay
now.
first, yeah.
The list of OSHC providers that he's talking about,
Yeah.
that he got presented with,
Yeah.
we'll be showing it.
Yes.
And
Somewhere over here.
yeah, you can do your own research. Don't go on our word just because
Yeah.
he's with NIB. Don't go with NIB. Just because I'm with AHM, don't go with AHM. Just because your friends are going with Bupa, don't go with Bupa.
Yeah.
Do your own research.
Yeah.
See what it covers, what it doesn't cover.
And it's also important to do your research, because these prices and the things that these providers cover keep on changing depending on their deals with the institutions and the hospitals here. So it's better to just go online and check the real information and what they cover, instead of just going on information that is provided by your agent, which may be dated, which may be wrong.
I've heard that a lot of universities provide their own OSHC.
Yes, they do. So my university actually offered Allianz, but I did not want to choose that because if I go through Allianz privately, it would just cost less. So which did not make sense to me, and that's when the agent provided the list. I was like, okay, there are more ones that exist.
Yeah.
So for example, I chose NIV, which covered more things than Allianz, and if I would have just chosen the one that my university offered, I would basically have less coverage.
Yeah. Now we'll go into the second part of the video is, what if something happens to you? What do you do then? So I broke my little finger, my left hand, back in September 2022 while playing cricket. And I got pretty worried because I didn't have family here, I only had friends. Maybe you won't even have friends because
if you're just coming here,
Yeah.
it's a high chance that you may not even know anybody here.
Yeah, and for something to happen to your hand, which is needed in every daily activity,
You can't do very important limb. You can't do anything without your hand.
Yeah. So I did my research. I had some friends who were doing physiotherapy, and they told me that it's better to get an X-ray just to be precautious. So I'm like, they told me the name of the X-ray. They told me the name of the joint. They told me the name of the lab that I have to go to. But I couldn't just walk into the lab and get an X-ray. I got to know about the process of how the Australian healthcare system works. And I got to know about it at the worst time possible,
Yeah.
which is when I needed it. So that is why we thought of making this video.
Yeah.
So that you know if something happens, if and when, that's what it doesn't, but if and when something happens, what
You know what to do.
You know
Yeah.
what to do. So then I had to go to a GP, which is a general practitioner, which is a normal doctor. A normal doctor is called a GP there. You go to a GP and book in your appointment with them. You know that you have to get an X-ray. They know that you have to get an X-ray. But you have to get a reference for the lab. Everything works on references.
Yeah.
So I just went in for a 5-minute appointment. She knew that I had to get an X-ray done. She wrote the X-ray and referred me to the lab. And then I went into the lab. Went into the lab, told them that, see, I went to this GP, I have this X-ray to get done. They booked an appointment for me. Fortunately, it was on the same day.
Yeah.
And then I got
Which usually is not the case because
Yeah.
even when I've booked appointments for even GPs, I usually get an appointment which is in the next week.
Yeah.
So there's a long
They're
wait
pretty
time.
booked up.
Yeah, they're always booked up.
I got my X-rays, and unfortunately, it was a minor fracture, which I got to know at the lab itself. That the person who did my X-ray, he only told me that's a minor fracture. But because everything works on God's references,
Yes.
I had to go back to the GP. The option that I was presented with was I can do one of two things, which is go to a private hand specialist, which wouldn't have been covered in my OSHC.
Yeah.
It would have been covered in some OSHCs, some OSHCs wouldn't cover.
Yeah, depends
Do
on the
your
provider.
research.
Yeah, do your research.
And it would have costed me around $450 to $500. Or second, go to the emergency room of the Royal Adelaide Hospital, which is the biggest public hospital here,
Yes.
and then wait for about 5 to 7 hours.
Yes.
So after
Classic
that,
RH.
yeah, I went with the latter option because obviously, as a student, I can't be spending $500 on just an appointment just to get my hand looked at. And after that, I would have needed 2 or 3 more appointments maybe.
Yeah.
I went to the RH hospital at 5 p.m. Got called in at 12:15 midnight.
Fun.
So full people. The emergency room was full of people.
As
who
it
may-
usually is.
Yeah.
As it usually is.
As it usually is, who maybe have COVID, who maybe don't have COVID,
Yeah.
who are going through different problems, and just waiting with them was difficult, is what I would say. And after that, everything was smooth. So I got looked at by a GP in RAH. I got booked in for a surgery day after because there were some complications that had to be dealt with, and fortunately, I didn't have to pay for the surgery. So that is where OSHC comes into play.
We've had completely different experiences. So every time I've gotten sick, I've opened my app. So there is a clinic right next to my house, and it is affiliated, but it doesn't cover all of the fees. So I still have to pay a little bit over that, which is called gap fees here. So in Australia, there's a list which is called the MBS, and all the fees of all procedures, appointments, and everything is listed there, and that's called the MBS. So that is how much the clinics are recommended to charge. If they charge anything over it, that's called the gap fees. These policies and these providers only cover the money for MBS. They don't pay gap fees. So you need to make sure that you're going to the right clinic. So what I did is I went to a clinic which is a bit further away, but it covered everything. I did not have to pay anything. It was very smooth. I just gave them my card, they noted down the number, I signed somewhere and walked out. And I've done that multiple times without any complications.
So how it worked for me in terms of OSHC was that when I went to the GP, I had to pay the gap fee, which was $12, because I didn't do my research. Second, I went to the lab, where I had to pay 15%. So I had to pay 100%. So I had to pay $250 to $300 at that time, and then I had to claim 85% of it from my OSHC. So I went to my app, uploaded the bills, called them and told them what all happened, and then I got 85% of it back. And then the third step was getting my surgery done, which was fortunately covered 100% by my OSHC. So a surgery which would have costed me $4,000 otherwise costed me nothing, and just a signature on a document that the bill is being sent to my OSHC. And when we're talking about these apps and checking if the institution is affiliated, for you to get access to that app, main thing you have to do, which a lot of international students forget, is that you have to activate your OSHC membership. When you land in Australia, you have to call your OSHC and activate your membership. They'll send you a physical card, they'll send you access to the logins of the application or even the web page, because that is one of the things that is needed for you to access their resources. Activate your membership as soon as you land in Australia.
Please.
Because it's better to have an activated membership before anything happens to you.
Otherwise, you have a broken hand, you're like, oh, I have to activate this now, you have to call someone, and if it's a weekend, they won't respond until Monday. So.
That is how the Australian healthcare system works. Everything works on references. Be proactive.
Get your OSHC activated, and you should be good.
And don't be afraid to ask for help.
Definitely.
Don't be afraid to ask for help.
People are very friendly here. They'll be open to help. Even if you're in the hospital, just ask someone who works there, and they'll direct you in the right direction. So Anshul, I think that covers about everything.
That is about it for the Australian healthcare system
and OSHCs. Thank you so much for watching. Like and subscribe, and
keep supporting us.
Keep supporting us.